Welcome to the deep dive. Today, we're jumping straight into something pretty complex, high-stakes knowledge, pulmonary arterial hypertension, or PAH.
Yeah.
It's a rare condition, often missed, and, well, our mission today is really to simplify it, cut through the jargon, make sure you walk away knowing what's what with a disease affecting thousands.
It was definitely a crucial topic, mainly because PAH is such a diagnostic challenge.
Right.
We're talking about something serious. Rare, yes, but still impacting about 50,000 Americans.
Yeah.
And maybe, 1,000 to 2,000 new cases popping up each year.
And fundamentally, what's it actually doing inside the body?
So PAH, it's defined by the blood vessels, the small ones in the lungs, becoming narrow, stiff, even.
Okay.
Think about plumbing. If those pipes constrict, the heart, the pump, has to work so much harder just to push blood through.
That extra strain. That's key, isn't it? And it leads right to that big problem our sources highlight, misdiagnosis. The data is, frankly, startling. Around 60% of cases get diagnosed as something else first. And that means delays, huge delays, of 2 to 5 years before the right treatment starts.
And that delay, well, it can be a matter of life and death. Early detection is just critical because the outcomes without it are severe. If you don't catch it, something like 30% of these patients end up developing serious heart failure.
Wow.
We really need to learn how to spot those signs before the heart just, gives out.
Okay. Let's try and make this memorable. A simple analogy might help. You mentioned plumbing. So PAH is basically like having clogged pipes in your lungs.
Exactly.
And the pump, your heart, is working overtime against all that resistance, and eventually, well, the pump just gets worn out, exhausted.
That's a perfect analogy.
Yeah.
It really helps understand how the symptoms start piling up.
Yeah.
Because the heart's straining, oxygen isn't getting through properly. PAH creates this whole constellation of signs. We pulled out 7 key symptoms, the most common, the most critical ones to recognize, but they often start subtly.
Right. So instead of just listing them off, maybe we can group them. What are the tier 1 symptoms? The ones hitting 70%, 80% of patients that should really wave a red flag immediately.
Yeah, okay, yeah. The really critical tier that's defined by fatigue, serious fatigue, and trouble breathing. Number 1, the most common by far, is shortness of breath. That hits 80% of patients.
80%?
Yeah, it's that feeling, of being winded, even when you're just sitting still, often the very first sign.
Which sounds so easy to dismiss, doesn't it, for patients and doctors? Just, oh, I'm out of shape or getting older.
Precisely. And right there with it is number 2, fatigue, affecting 70%. And this isn't just, I had a long week. It's this chronic, extreme tiredness that makes simple things like carrying groceries or climbing one flight of stairs feel completely draining.
Okay.
Just those 2, hitting over 2/3 of patients, really show why screening needs to focus there early on.
So if those are signs the oxygen isn't getting through, what about signs the heart itself is struggling, that pump working too hard? What's in that tier?
Okay. That brings us to symptoms 3 and 4. We see chest pain in about half the patients, 50%. That tight, heavy feeling. It comes from the heart muscle just straining against that huge pressure in the lung vessels.
Makes sense.
And number 4 is heart palpitations. That's about 30%, feeling like your heart is racing or skipping beats. It's basically the heart trying desperately to keep up to maintain blood flow.
Right. Clear signs the pump is under duress. What about the last 3 symptoms, the ones that maybe signal fluid backup or really severe oxygen problems?
Yeah, the remaining 3 are pretty crucial indicators that things are getting more advanced. Number 5 is dizziness, around 40%. Feeling lightheaded. Often happens because not enough oxygen is reaching the brain, especially when people stand up or move suddenly.
Okay.
Number 6 is swelling or edema. That's 30%. Usually shows up in the ankles and legs.
Whoa.
That's a visual cue, really, that the heart isn't circulating fluid efficiently anymore. It means heart failure is becoming a real immediate concern.
And the last one, the most alarming sign.
That would be number 7, blue lips or fingers. It's called cyanosis. Affects about 20%. If you see that bluish tint, that signals severe system-wide lack of oxygen. Really serious.
So 7 major signs. Many are really common within PAH patients, and yet our sources keep reminding us the disease is so tricky that 2 other symptoms often get completely missed in those initial checks.
Right, the more subtle ones. We often overlook a persistent dry cough. That affects about 20% too. And then there's fainting, which you usually only see in about 15% of cases, typically when it's quite severe.
So 9 markers in total, really.
Yeah, and the fact that doctors often miss these, leading to that 60% misdiagnosis rate, it tells you something's fundamentally not working right in how we spot this early.
That's the big question then, isn't it? Why? Why, with these signs, some quite common, is that misdiagnosis rate stuck at 60%? It feels like it's more than just oversight.
Well, the main reason is that PAH is a great mimic. Its most frequent symptoms, shortness of breath, that crushing fatigue, they look exactly like symptoms of really common, much less dangerous things.
Like what?
Like general anxiety, maybe chronic stress, just getting older, or even mild asthma. A doctor's first thought is almost always going to be ruling out the common stuff before they even consider something rare like TAH.
Yeah, I can see that. If 70% of patients feel that fatigue and they're busy, stressed people,
Yeah,
they're going to think it's burnout. Or their doctor might think that long before anyone considers stiff lung vessels.
exactly. You mentioned that social media post earlier, the person saying, thought I was just tired, PAH was the real issue. That sums it up perfectly. It shows that built-in bias in diagnostics today, leaning towards lifestyle factors when symptoms seem vague, rather than digging for an underlying disease.
And this vagueness, it doesn't hit everyone the same way, does it? Our sources are pretty clear that some groups face much longer waits for a diagnosis. The most glaring one is women. They make up 70% of PAH cases.
They absolutely face longer delays. It really raises a serious question about potential systemic biases, doesn't it?
Yeah.
Are symptoms like fatigue and pain, which are so common in PAH, maybe being taken less seriously in women, or perhaps attributed more often to psychosomatic causes? The data just shows a clear difference in outcomes, regardless of the exact reason why.
And age is a factor too, surprisingly.
It is. We often think of heart conditions hitting older people, right? But 60% of PAH diagnoses happen between the ages of 20 and 50.
Crime working years.
Exactly.
Yeah.
Peak productivity age. Which means those symptoms, fatigue, shortness of breath, are probably even more likely to be brushed off as, oh, you're just too busy or you need to exercise more.
And we absolutely have to mention the increased risk for people already dealing with other chronic conditions.
That's a critical link. People with connective tissue diseases, think lupus or scleroderma, they have a 30% higher risk of developing PAH. These existing conditions should be huge red flags for doctors, but somehow the delays still happen even then.
So if we look at the fallout from this systemic issue, this 60% misdiagnosis rate, the delays, the long-term costs are just enormous. It's not just about feeling unwell.
Yeah. It carries a severe mortality penalty.
Eh.
Untreated PAH bumps up mortality rates by 25%. And that awful diagnosis of heart failure, that hits 30% of patients. That translates to roughly 15,000 heart failure cases just this year, directly linked to PAH.
15,000. And when you put that next to the 5-year survival rate for untreated patients, which is only 50%, well, the need to shrink that 2 to 5 year diagnosis gap becomes incredibly, incredibly urgent.
Awareness, vigilance, and just being aggressive about investigating symptoms. Those are the only things that are going to move that needle.
Let's pivot a bit then. Where does PAH actually come from? We've talked a lot about the consequences, but what are the roots?
Generally, we can sort the causes into about 3 main areas. A small slice, maybe 10% of cases, are purely hereditary. They're linked to specific gene mutations, like one called BMPR2.
Okay.
Then you've got environmental triggers. That accounts for roughly 20%. This could be exposure to certain toxins, maybe infections that damage the lung systems.
And the biggest piece is still related to other health problems someone already has.
Yes, exactly. Associated conditions account for about 30% of the origins. This is where those connective tissue diseases we mentioned, like scleroderma or lupus, play a really significant role in actually triggering PAH.
So, based on those origins, how do doctors actually classify the disease once they finally pin it down?
The clinical classification usually breaks down into 3 types that mirror those origins. The biggest group, about half of all cases, is associated PAH. That's where it's directly tied to that underlying systemic disease.
Right.
Then you have idiopathic PAH. That's about 40%. This is kind of the medical mystery category where they just don't know the cause. It appears out of nowhere. And finally, that 10% falls under hereditary PAH.
What's really interesting here is how understanding all this complexity lets us see the positive side. What's the actual value financially and in human terms of acting early, even with a rare disease like this?
Oh, the return on investment for catching it early is huge.
Yeah.
We saw 2024 data showing that timely diagnosis cut hospital stays by 20%. That saved an estimated $400 million. And that's just the financial part.
400 million. That's a massive saving. It really shows the ripple effect on the whole system when you get the diagnosis right quickly.
Absolutely. And the treatments themselves, they offer real hope. Things like vasodilators, drugs that widen the blood vessels, or even just simple oxygen therapy. They've been shown to improve symptoms for 60% of patients within just 6 months.
Wow.
It is treatable. It's manageable. if you catch it early enough.
You mentioned the human side earlier, the power of being vigilant. Can you share that story again about the young woman? Because it really captures that fight against misdiagnosis.
Yeah, it's such a powerful example of patient advocacy.
Mm.
A 24-year-old woman. She had years of shortness of breath, fatigue,
Mm.
symptoms that were just repeatedly dismissed as asthma, simple asthma.
Hmm.
It was only because she kept pushing, insisted on more specialized testing, specifically a right heart catheterization, that they finally confirmed PAH. Getting that diagnosis, starting the right meds, the vasodilators, it meant she finally got her life back.
And the lesson there isn't just about her individual survival, right? It's about the wider impact of awareness. When one person pushes back, it can actually nudge the whole system.
It really does. Our sources confirmed that broad awareness campaigns have already boosted screenings by 20%. That's significant. And on the health side, getting diagnoses earlier has systemically cut heart failure rates by 15%. That's a huge win for public health.
Okay, I think this deep dive really worked. We simplified PAH, thinking of it as those clogged lung pipes tiring out the heart. We nailed those 7 key symptoms: shortness of breath, fatigue, chest pain, dizziness, swelling, palpitations, and that blue tint, cyanosis. And we clearly see now why early persistent action is just vital for the 50,000 Americans living with this right now.
And the stakes are so high. If you connect this knowledge back to the bigger picture, the potential payoff, financially and for people's lives, it's massive. There's data suggesting that just by raising awareness and improving diagnostics here in the U.S., we could prevent 25% of all PAH complications. That can save something like $1 billion by 2030.
$1 billion?
Yeah. Simple explanations, like we tried to do today, and more vigilance from doctors. Those are the main tools we have to finally beat that stubborn 60% misdiagnosis rate.
We bring you vital health insights like this daily. So to get more of this kind of crucial information, please make sure you visit Mind Expansion Daily. Now, if this deep dive was helpful, we just have 2 quick asks. First, please like and subscribe to Mind Expansion Daily. Second, if you really got value from this, you can support the show by buying us a coffee. The link for that is right in the description.
Helps keep the lights on.
It does. And we also challenge you, leave a comment. Do you agree with our summary of PAH? Disagree? Let us know. And finally, tell us where you're listening from. We're always trying to grow our reach around the world.
And maybe before we wrap up, just one final thought to leave you with. We know about 100,000 people globally have PAH, and maybe 30% of the complications worldwide could be prevented with early diagnosis. So just imagine, how far could truly global vigilance really stretch those savings, both in money and, more importantly, in lives saved across the entire planet?
That's a powerful number to chew on. Thanks for joining us. We'll catch you next time on The Deep Dive.